All right, the doctor is in. We're talking about a viral infection that was at one time declared eradicated in the U.S. The measles has reemerged with outbreaks across the country. Dr. Anurag Malani, the medical director of hospital epidemiology at Trinity Health, Michigan, Ann Arbor, joining us today. So thanks for being here, doctor.
Thanks for having me on.
We talked to you a lot during the pandemic, of course, a very busy time, but it seems like we're always busy dealing with either new stuff or old stuff that's coming back. Let's talk about this measles issue. So give us the current situation.
Yeah, so measles is a virus that many of us are familiar with, but most of us have never seen before. It was, as you mentioned, it was a virus that was eradicated in the United States back in...
I mean, it was gone.
Yeah, gone, meaning that there was just kind of sporadic cases. And it was eradicated in the year 2000. And so then if you look at the last 20, 25 years or so, we've typically had about 100 cases or so a year. Most of the cases that we see in this country are unvaccinated individuals that travel abroad and bring measles back unknowingly.
Okay. So what is the concern right now? Why is we getting this warning from the CDC?
Yeah, so we're seeing cases pop up in multiple states. In our own state, we've had 3 cases in the last month, and again, those are in unvaccinated individuals. What we want to know about measles is it's a virus that's characterized by having fevers and upper respiratory symptoms, such as a cough, runny and red eyes, called conjunctivitis, and after they develop a fever and those symptoms, an individual can develop a very characteristic rash. It starts at your hairline and up on your face, and it spreads downwards. And what's important about measles, it's very infectious. So if you're unvaccinated and you get exposed to measles, there's about a 90% chance that you actually contract measles.
So highly contagious, and even if a person who has measles is in a room and then leaves the room, the virus is still circulating, right?
Yeah, so measles is spread through droplets or aerosols, so it's spread through the air. So if someone coughs or sneezes, and you're absolutely right, it can linger around in the air for a couple hours. So you may not necessarily know if you come into a space where someone had measles. Right now, the risk of contracting measles in our state, in this country, is extremely low.
Okay, that's good.
But the concern is that we're already seeing many more cases. We've seen about 60 cases in the country this year, which is way ahead of where we were last year. And if we look at what's happening internationally and globally, in Europe last year there was 30,000 cases, and the year prior there was about 1,000 cases.
Wow. So it's also very deadly, we should point out. That's the concern, or somewhat deadly.
Yeah, so, and you're right. Like, so what is the concern about measles? Why should we care? So about 1 out of every 4 individuals becomes hospitalized. The folks that are at risk are the very young, folks that are older, if you're pregnant, if you have a weakened immune system. About 10% of kids will develop an ear infection. A little bit smaller percentage will develop pneumonia. And the very drastic outcomes are something called encephalitis, which is brain swelling and inflammation of the brain, and then death, which happens about 1 in 1,000.
Okay, good. So if you're not vaccinated, get vaccinated, you would say, is the advice.
Yeah, absolutely. And so the vaccines, they're a little bit different than the COVID vaccines. If you've had the measles vaccines, you have lifelong immunity. So it's very durable immunity. 1 vaccine is about 93% effective. 2 vaccines are 97% effective. So if you travel internationally, you absolutely want to get your vaccines. One of the concerns is when we look at vaccine rates in our state, and we look at the 4 to 6-year-olds and the kindergartners, which is typically the time, it's a 2-dose vaccine. Usually get 1 at 12 to 15 months and the second at 4 to 6 years. Those rates in the 4 to 6-year-olds across the state have fallen several points after the pandemic.
So that's why concern for this young population. Doctor, we'll continue the conversation in our next hour. We'll talk more about adults wearing masks and anything else that might be going around right now that we want to cover. All right, thank you so much.
Okay.
Let's talk about measles, because that is something that has returned, and a lot of it is due to the fact that people are not vaccinated. But that's not the only thing that we need to be concerned about. So we're going to talk about all of it right now. Dr. Anurag Malani, the medical director of hospital epidemiology at Trinity Health Ann Arbor, Trinity, Michigan, is here with us this morning. Doctor, let's talk numbers real quick. So when we talk about vaccine rates, as it pertains to the measles, because that's what's driving up this rise in cases, right? A lack of vaccinations.
Yeah, and so measles is typically a 2-vaccine regimen, and the first vaccine is usually given to kids at 12 to 15 months, and then the second one is at 4 to 6 years. When we look at vaccine rates across the state for kindergartners, or that 4 to 6 age group, it's below 84%, which is several percentage points lower than if we were to compare before the pandemic. We know that actually for us to sort of not see transmission of measles, the immunity in the population, something that we call herd immunity, needs to be at about 95%.
Okay. What do we attribute this drop in immunizations to?
Yeah, I think there's a few reasons. One is we know in the early parts of the pandemic, there was really issues with access to care, getting in to see your pediatrician, getting in to see your doctor. But more recently, I think there's been issues, you know, with misinformation, disinformation. There's been vaccine hesitancy. In terms of the COVID vaccine, there's a couple important differences when we look at the COVID vaccine and the MMR, the measles, mumps, and rubella vaccine. The measles, mump, and rubella vaccine is very effective. So if you get your vaccines as a kid, so I had my vaccines, and I'm giving my age here, but in the 1970s, and I wouldn't need to get vaccinated again. I have sort of lifelong immunity. Okay. That's one important difference than the COVID vaccines, which, as we know, it's much more frequent vaccinations, similar to the flu vaccine, where most people are going to try to be vaccinated once a year.
Okay, let's just talk about, as we see a handful of cases, and we're expecting to see more measles cases because it is so contagious. If you are like you and I, who had this vaccine as kids, we're fine. And if you're older, you're okay too, because you've probably been exposed, right?
Right, and so how we define immunity is basically if you're born before 1957, and so that would be one portion of the population, and then the other population would be is if you've had measles before, which is not many of us right now, or if you've had receipt of the vaccines.
Gotcha.
The concern really is most of the measles that we see in this country right now is in unvaccinated travelers that travel abroad. And there are many outbreaks going on globally of measles. Right,
because of lower vaccination rates in other countries.
Absolutely.
Gotcha. Let's talk about COVID. It is still around. What are you seeing at your hospital? Yeah,
so the good news with COVID is we're at a much better place in March of 2024 than where we were in 2 years ago, 3 years ago, and even at the start of the pandemic. So 98% of the population in the country has either had vaccine or had infection or had both. So there's a fair amount of immunity in the population, and we know that there are effective vaccines. We also know that there is effective and safe treatment. So those that are at greater risk for having poor outcomes, we have tools in the sort of toolbox to give them to try to prevent severe illness from happening.
Doctor, what did we learn about mask wearing as it relates to COVID, and now we're dealing with flu and RSV, even measles for that matter? When is it, because I see people walking around in masks now still, when is it recommended, and do they actually do anything to protect us, or are we protecting other people?
Yeah, so the first part, I'll take the latter part of the question. Masks definitely work. They work if you're having symptoms and you're infectious. They can help reduce the amount of sort of droplets and aerosols that are actually coming to other individuals. And for the wearer, so the person that's actually wearing the mask, they can actually help filter out the air and prevent less from coming in. Okay. So definitely are effective. When do you wear them? So at times where we're seeing a lot of respiratory viruses, that might be a time to sort of consider wearing. You're going to a sort of a large indoor gathering where maybe you don't know what's going on. The other thing that's come up in the last couple weeks is the CDC has released community respiratory virus guidance and try to put all these things together.
Streamline it, right?
Yeah,
right.
Streamlining it. And so putting, you know, COVID guidance, flu guidance, RSV guidance, all these respiratory viruses to try to have the same sort of guidance.
Right.
And what those steps entail, they basically say, okay, if you have COVID or you have another respiratory virus, as long as your symptoms are improving, so cough, congestion, sore throat, symptom improvement, and you're not having fevers, and you're not taking Tylenol to suppress the fevers,
Right.
you can go back to school, you can go back to your activities, and some things you may want to consider for those sort of first 5 days after coming back to whatever you're doing is maybe wearing a mask because of the reasons we just talked about, thinking about distancing between people, thinking about what does ventilation look like.
Right.
So there are some steps
Being
that
aware.
you can. Yeah.
All right,
yeah.
good stuff, Doctor. And just real quick, the mask, does it have to be the N95 or it can just be the regular mask?
I think a regular mask would be fine.
That'll
The
do it,
N95s have a little bit more effective filtration, but
Right.
those can also be more difficult to wear. So
All
I
right.
would go by comfort there.
There we go. We're learning so much as we go through, so that's good. Good stuff. Dr. Malani, thank you, as always. We appreciate your insight. Ryan?